My name is Melissa Pynnonen. I'm a professor of otolaryngology at the University of Michigan. Today, I will discuss managing nosebleeds when you're on anticoagulation. So first of all, what is a nuisance nosebleed? Well, certainly a nuisance nosebleed is messy. You get blood on your hands, blood on your clothes, the bathroom towels. You might wake up with a nosebleed and you have blood on your pillow and your sheets. With a nuisance nosebleed, blood drips from the nose. It might drip in separate droplets. It might run as a small stream of blood. You might see blood clots. Some of them might be as large as a grape or a quarter. And you might spit some of these blood clots from your mouth. Nuisance nosebleeds might last off and on for hours. They might finally stop and then start again, seemingly for no reason. This is what I'm talking about when I talk about nuisance nosebleeds. Nuisance nosebleeds are really common, especially for patients on anticoagulant medication. Nuisance nosebleeds can often be stopped at home if you know exactly what to do. Before we talk about managing nuisance nosebleeds, let's talk about major nosebleeds. Major nosebleeds cannot be safely treated at home and do need to be treated in the emergency department. So let me contrast for you the difference between a nuisance nosebleed and a major nosebleed. When a patient has a nuisance nosebleed, the blood runs from the front of the nose. In contrast, when a patient has a major nosebleed, there's so much blood and large clots that they're coming out of the mouth and the throat. The patient might feel like they're choking on the blood. When a patient has a nuisance nosebleed, she can use tissues or paper towels to soak up the blood. In contrast, when a patient has a major nosebleed, there's so much blood that she needs to use bath towels to soak up the blood. And finally, when a patient has a nuisance nosebleed, she may experience that nosebleed as a small drip from her nose. It might be off and on, and it might last for hours. In contrast, with a major nosebleed, the patient will have a large amount of bleeding in a short period of time. On this slide, the symptoms in bold print are symptoms of major nosebleeds. Major nosebleeds, when they occur, are terrifying. They cannot be treated at home. You must call 911 or go to the closest emergency department. So now let's talk about nuisance nosebleeds. This picture shows the inside of the nose. We're actually looking inside the left nostril. On the left side of the picture, you see the nasal septum, which is the gristle in the middle of your nose that separates one side from the other. The septum, as you can see, is covered with this pink tissue called mucosa. The mucosa is pink because there are so many small capillary blood vessels in the mucosa. The mucosa can dry out. This often happens in the winter when the air is dry, or it commonly happens to patients who use nasal cannula oxygen. The oxygen is very dry. And this dry oxygen or dry air dries out the mucosa, and these blood vessels, which are close to the surface, crack open and bleed. That's what causes a nosebleed. Eventually, the blood will clot and the bleeding stops. However, if you take anticoagulant medication, it can take a long time for that bleeding to stop. Another thing you see on this picture is the place where the epistaxis or the bleeding is coming from. It's in the center of the picture and there's a white arrow pointing to it. On the right side of the picture, you see some lines. They're just a little bit out of focus. Those lines are hairs in the nostril. And the hairs in your nostril, they're at the very front part of the nose. The reason I show you this picture is to make the point that most nosebleeds come from that very front part of the nose. Oftentimes, patients will tell me they feel like the blood is coming from higher up or farther back. But in fact, that is rarely the case. More than 90% of the time with nuisance nosebleeds, the blood comes from the front part of the nose, and that makes the nosebleeds easier to manage. Now I'm going to show you a video of myself and how I managed a nuisance nosebleed. During this video, I will describe using a nose spray medication. In the video, I refer to it as Afrin nose spray, and I use this to stop my nosebleed. Let's watch the video and I will show you how.
Nosebleeds can strike any time, particularly during the cold, dry months of winter. While they can be a messy nuisance, they are rarely an emergency. When a nosebleed strikes, remain calm. Lean forward. If there is blood in your mouth, spit it out. Do not swallow it. Apply 3 sprays of decongestant spray, such as Afrin, into the side that is bleeding. Pinch the soft part of your nose shut. Pinch the nose for 10 minutes. Use a clock to keep track of time. Resist the urge to release the pressure on the nostrils after a few minutes. After 10 minutes, let go of your nose. If it is still bleeding, soak a cotton ball with nose spray and place it into the bleeding nostril and pinch for another 10 minutes. Again, use a clock to time it. Once bleeding has stopped, do not blow your nose for at least 2 days. Check your blood pressure if possible. High blood pressure can cause nosebleeds. Do not pinch the bony bridge of your nose. Remember, pinch the soft part of your nose closed. Do not pack the nose with tissues or other household items, like gauze, tissues, or tampons. This can make the bleeding worse. Do not tilt your head back or lie flat. This may cause you to choke on blood. In addition, blood in the stomach can make you nauseous and cause vomiting. Do not lift anything heavy, like groceries, or perform physical activities or household chores such as vacuuming. Do not pick up young children and babies. Avoid activities that involve bending over and causing the pressure in your sinuses to increase. Remember, it can take up to 2 full weeks to heal after a nosebleed. Preventative care is essential when managing nosebleeds. Most of the products used to treat and prevent nosebleeds can be purchased at your local pharmacy. It is also important to keep your nose and nostrils moist during the dry months of winter. Some ways to keep your nose moist include: use an over-the-counter nasal spray every 2 to 3 hours while you are awake. Use a cool mist humidifier to moisten the air in your room while you sleep. Coat the inside of your nostrils with Vaseline or air saline nasal gel twice daily, especially at night. Some patients prefer to place a cotton ball coated in Vaseline in the affected nostril overnight. If you use steroid nasal sprays, such as Flonase or Nasocort, call your doctor and ask if you need to continue their use. Steroid sprays can dry out your sinuses and increase the risk of nosebleeds. Remember, using nasal saline spray and Vaseline are the best methods for preventing nosebleeds. It is important to contact your anticoagulation provider about your nosebleeds. They may want to perform a blood test or determine if there have been any other changes in your health. If you continue to experience frequent nosebleeds, you may benefit from an evaluation by an ear, nose, throat physician. Keep in mind that the anticoagulation clinic can help arrange that appointment if one becomes necessary. It is important that you contact your anticoagulation provider if you have more than 3 to 4 nosebleeds per week or more than 6 per month when following the tips provided in this video. Nosebleeds are a nuisance, but rarely an emergency. However, there are some situations when nosebleeds require immediate medical attention. Bleeding that does not stop in 30 minutes, bleeding that is very heavy and that includes blood running down your throat and out of your nostrils, bleeding with other symptoms, including, but not limited to, high blood pressure, dizziness, chest pain, or rapid heart rate. These symptoms may require special treatment. Remember, nosebleeds are common in patients who take blood thinners. They can be frightening at first, but are rarely dangerous and can be easily managed at home if you know what steps to take to prevent them and what to do when they occur.
With the advice in my video, you can try to manage your nuisance nosebleeds at home. You will need to buy cotton balls and nose spray. And I'd recommend that you buy these supplies before your first nosebleed. That way you'll be prepared and the experience will be less frightening. On this slide are listed 2 types of decongestant nose sprays, oxymetazoline and phenylephrine. Either one of these types of medicines will work to treat a nosebleed, and there are several brand names listed there for you as well. I can explain a bit about how these medicines work. A blood vessel is like a pipe. It has a diameter, and these medicines cause the diameter of the blood vessel to decrease. That means the blood vessel squeezes down, it gets smaller, that slows down the bleeding and allows a blood clot a chance to form. This, in conjunction with holding pressure on the soft part of the nose, can be very effective to treat a nosebleed. In fact, if I am in the emergency department and I see a patient who has a nosebleed, this is exactly how I treat it. And finally, when should you see an ear, nose, and throat specialist about your nosebleeds? So if your nosebleeds occur frequently, it can be a messy, frustrating nuisance, and an ear, nose, and throat specialist may be able to help. As a general guideline, I suggest 3 or more nuisance nosebleeds a month might be enough that you would benefit from seeing a specialist. And then certainly a severe nosebleed. So any nosebleed that's bad enough that you need to go to the emergency department to have it treated, it's worth seeing an ear, nose, and throat specialist to follow up on that. So in conclusion, nuisance nosebleeds can often be treated at home. Be sure to keep supplies on hand, including oxymetazoline or phenylephrine nose spray and cotton balls. If you have frequent nosebleeds, see an otolaryngology or ear, nose, and throat specialist. Do not stop your anticoagulant medication. And if you have frequent nosebleeds or a major nosebleed, you certainly should call your anticoagulant provider. Thank you for listening.